I'm Tom Schaetzel. I work for the Manoff Group, which partners with PATH to implement the Infant and Young Child Nutrition Project for USAID's Global Health Bureau. I'm the project's technical director. This year on World AIDS Day, I mostly think about new opportunities for babies born to HIV-infected moms. For many years, we've had good interventions to help moms reduce the risk of transferring the virus to their baby during pregnancy and at delivery. But after delivery, we really haven't had any satisfactory choices. The mom either had to choose between avoiding breastfeeding, which means formula feeding, or on the other hand, to breastfeed for a shorter duration and to stop early and then try to feed her baby without the benefits of breast milk. The problem with formula feeding, of course, is that in poor countries, it's associated with much higher risk of death due to infections like diarrhea or pneumonia, or due to malnutrition. The problem with short-duration breastfeeding is that during the breastfeeding time, the baby's still exposed to the virus, and after that, it's difficult for the mom to feed the baby properly without the benefits of breast milk. In countries like Zambia and Cote d'Ivoire, IYCN has been helping these moms who choose to breastfeed, helping them to establish exclusive breastfeeding because that's safer in terms of transmission of the virus than mixed feeding, which would involve adding other fluids or other foods. After these moms stop breastfeeding, we also help them to find ways to feed their children properly, even though they're not able to breastfeed. Either way, it's a difficult proposition. Now we have a new opportunity. This new opportunity is a result of research over the past few years that show that if mothers use ARVs to keep viral load down, the risk of HIV transmission through breastfeeding is dramatically reduced. That means with ARV interventions, breastfeeding can continue safely for much longer. So our challenge now is to find moms who need ARV intervention treatment for their own health and help them to get on the treatment and help them to adhere to it, and then also to help moms who don't need ARVs for their own health to participate in a less intensive prophylactic ARV intervention. With these in place, and with continued efforts for safer breastfeeding, the risk of HIV transmission to babies after delivery should go down dramatically. So this year on World AIDS Day, I look forward to the promise of these new interventions for saving babies' lives. But we also look forward to the challenge of getting these ARV interventions in place to make this promise into a reality.